Hello everyone, my name is Maura and today I will be presenting my community health project. This project focuses on family of children with autism in the Miami area, and I will be applying the nursing process to assess the community, identifying a key issue, and propose a plan to improve health outcomes. Community health nursing focuses on improving health outcomes at the population level rather than only treating an individual patient. In this project, I applied the nursing process, which includes assessment, diagnosis, and planning to better understand the needs of a specific community. Um, the population I focus on includes children with autism spectrum disorders and their families. This group is considered vulnerable because managing autism requires long term care, access to resources, and a strong caregiver involvement. And an early intervention and consistent support plays a role, a critical role in improving the developmental outcomes. The community that I assess is located in South Miami, Florida, and it's was done on an ABA Center, which is Applied Behavioral Analyst Therapy Center. And this center serves children diagnosed with autism and other developmental delays. The population is very diverse, with a large Hispanic representation, which introduces additional factors such as language barriers and cultural differences in healthcare understanding. This center provides therapy services, caregiver education, and support resources, although the access and engagement vary amongst families. During my practicum hours, I conducted a community assessment through direct observation. I observed therapy sessions led by the BCBA, which is the behavior analyst, and the RBTs, which are the therapist. And I also evaluated the caregiver involvement. One of the most important findings was that caregiver participation varied significantly amongst families. Some caregivers were very engaged, while others seemed unsure about how to apply the therapy strategies at home. I also observed that the center relies partly on donations to support families, which reflects underlying financial challenges. Although education sessions are offered, attendance is very inconsistent and suggests barriers such as time limitations or lack of awareness. One thing I noticed during the hours that I was there is that even when caregivers were present during therapy sessions, not all of them fully understood how to continue those interventions at home. For example, some caregivers would observe the therapies using a specific technique, and they were not always confident enough to apply those techniques independently. And this gap between observing and actually implementing the care is very important because consistency outside the clinical settings is essential for the progress of these children's. When analyzing this community, several risk factors and social determinants of health became evident. The first major factor is limited caregiver education, which directly affects how well the families can manage autism related behaviors. The second one is economic instability, which may limit access to consistent therapies and specialized services for the children. The third is limited access to healthcare, especially for specialized developmental care. Language barriers and limited social support systems also play a very important role. And these risk factors do not exist independently, but rather interact with they rather interact with each other. For example, a caregiver with limited financial resources may also have reduced access to education and healthcare services. And additional language barriers can make it more difficult to fully understand the instructions or engage in asking questions or and that can further impact care. According to Healthy People 2030, social determinants such as education, economic instability, and access to care can significantly influence health outcomes. Now, the top three health conditions impacting this community includes autism spectrum disorders, which is the primary condition being treated. Excuse me. Second, it's developmental and behavioral disorders, which can often coexist with autism and affect communication and social functioning. And the third is mental health challenges amongst the caregivers, including stress, anxiety due to the demands of a long-term caregiving. According to Centers for Disease Control and Prevention, autism can affect 1 in 36 children in the US. It is also important to recognize that autism does not exist in isolation. Many children experience additional challenges such as sensory processing difficulties, communication delays, behavioral concerns. At the same time, caregivers often experience emotional stress, which can impact their ability to consistently provide care. And this highlights the importance for addressing both the child and the family as a whole. In addition to these conditions, to these health conditions, it's very important to consider potential disasters that may impact this population because we're in South Florida. Hurricanes are a major concern that can disrupt the access to therapy services and healthcare. Public health emergencies such as infectious disease outbreaks can also affect the access to care. And for children with autism, disruptions in their routines can significantly worsen behavioral outcomes, making the continuity of care especially important during these emergencies. Based on my assessments, the primary issues that I identified is a deficit in caregiving education and the training. Although the therapy services are available, there is a gap in how effectively caregivers are able to apply therapeutic strategies at home. And this leads to inconsistent reinforcement of therapy, which reduces its effectiveness and delays the progress of the children. This issue is particularly important because the therapies for autism is not limited to what happens inside of the clinic. So, a large portion of the progress depends on how consistently these strategies are applied at home. If the caregivers are not fully confident or educated enough, the effectiveness of these therapies are significantly reduced. Now, this issue has significant consequences for both children and caregivers. The children may experience slower developmental progress, ongoing behavioral challenges when these therapies are not consistently reinforced at home. And the caregivers may experience increased stress and frustration when they feel unprepared and when they see that their child is not progressing as they could be. Research by the Lancet Autism Review highlights that strong caregiver involvement is essential in improving outcomes for children with autism. Using the nursing process, the diagnosis identified is deficient knowledge amongst the caregiver related to limited access to autism specific education and resources, as evidenced by inconsistent use of therapy strategies and caregiver uncertainty. The goal of this project is to improve caregiver knowledge and confidence. Objectives include increased participation in education sessions, improving consistency in therapies at home, and enhancing understanding of autism per se. To address this issue, a comprehensive intervention plan is proposed. This includes structured caregiver education, workshops, hands on training sessions, and multilingual educational materials to ensure the accessibility. Support groups can provide emotional support and shared learning opportunities. And it is also important that these interventions are practical and easy to apply in real life situations. Caregivers often have multiple responsibilities, so education must be very simple and realistic. Providing demonstrations and real life example can significantly improve their understanding. And this approach aligns with the principle described by the health behavior therapy, which emphasizes that the importance of knowledge and confidence in behavior changes. Excuse me. Now the Uh, intervention is supported by a health beliefs model, which explains how perceived barriers, benefits, and self efficacy influence behavior change. By improving knowledge and confidence, caregivers are more likely to actively participate in their child's care. The expected outcomes include improved caregiver confidence, it's the goal, better consistencies in therapies at home, which will lead us to improve developmental outcomes in the progress of these children's. Additionally, the caregiver stress is expected to decrease. Now, the nurses play a key role as educators, as advocates, and as care coordinators. From my experience in healthcare, education is one of the most powerful tools to improve outcomes. Even small amounts of educations can significantly increase the caregiver confidence. And by supporting the teaching of the families, nurses can have a long term impact on both the child and the entire family. In conclusion, caregiver education is a critical component in managing autism spectrum disorders. This project identified a key gap and proposed a targeted intervention plan. Excuse me. By improving education and support, we can enhance both caregiver and child outcomes. And in the next phase, the focus will be on implementation and evaluation. We hope that with this project, the caregivers are able to conduct better therapies at home. We want to give education to the parents. We want to give the resources that they need so that they can have a better understanding of their child's situation, of their condition, because every condition is completely different. Some kids may have some levels of autisms, and um, some others can display better signs of it. And it all depends their specific children. We can give these educations to the parents based on what their children actually has, and we can expect that the education is more personalized for the parents, and obviously this will decrease the frustration in them, and it's going to be a win-win. We uh, improve the child's development, and we also improve the parents, how the parents feel about these therapies. So thank you so much for watching, and we'll be seeing each other in the next class. These are my references, and I hope you have a great day. Thank you.